welcome friends, myself Salma Gandhi here to help you for the PSM subject. So from now on we'll start with the communicable diseases, and among the communicable diseases we'll start with the diphtheria, respiratory infection. So let us first discuss the headings through which we see these diseases. First I'll give you a brief introduction, then we'll see the epidemiological determinants like agent factor, host factor, environmental factor, mode of transmission, portal of entry, incubation period, clinical feature, control of the disease, diagnosis of the disease, right? Prevention and treatment of the disease. Let us quickly start with our today's topic, that is diphtheria. So diphtheria is basically an acute infectious disease, okay, and this disease is caused by the bacteria Corynebacterium diphtheria. So for clinical purpose we have divided this disease into three parts: anterior nasal parts, facial part, and the laryngeal part. Now this bacteria is specifically it affects the pharynx, that is throat. It goes into the throat, it remains there, it stays there, and then multiplies over that area. And what it causes, over time it releases an exotoxins. So this release of the exotoxins by the bacteria causes certain changes in our body. So there are four changes. First, we all know that is formation of the grayish or the yellowish membrane over the tonsils, pharynx and the larynx, right? Second one, it causes the congestion, edema and local tissue destruction. Fine. Third one, what it causes, that it also involves the lymph nodes and resulting into the enlargement of the regional lymph nodes. And lastly, we see the sign and symptoms of this toxemia. Fine. Now, this exotoxins, not only it affects the pharynx, it also affects the heart and nerves. In the heart, it causes the myocarditis, and in the nerves, it causes the paralysis. Okay. So this was regarding the bacteria. This disease is basically an endemic disease. Okay. And due to immunization nowadays, this disease has declined to about 99.06%. Okay. So this was the whole introduction regarding this diphtheria. That what is causing this disease, right? It is the Corynebacterium diphtheria. What it affects, so pharynx, and clinically we have divided into three types, and we have seen it is an endemic disease, and due to immunization this disease has declined over the years. Now we'll start with the epidemiological determinants. So in that agent factor is the Corynebacterium diphtheria. Corynebacterium diphtheria, it has three types, right? Gravis, mitis and intermedius. Out of gravis is the most severe form of the disease. Okay. And this bacteria is basically gram-positive bacteria. It is non-motile. It does not have the motility. And there is no invasive power. So it does not penetrate into our pharynx. So it has no invasive power. Then it is sensitive to penicillin. Also, it is readily killed by the heat and chemicals. And lastly, it can survive for a short period of time in dust and fomites. Okay. So this was regarding the agent. Now, where this agent do live, or what is the source of infection? Source of infection is the cases and carriers. Cases, there may be clinical and subclinical. Clinical or subclinical. And the people who having mild infection are likely to have a minor symptoms, right? Like sore throat, running nose, etc. And among the carriers, there are two types. Either they are temporary or they are chronic carriers. Depending on that, the person unlikely gets infected for a period of time. Now, this agent is infecting what? So we'll see the infective material. What is the infective material? So it is nasopharyngeal secretions, right? Also, if infect the discharges of skin lesions, and also contaminated dust and fomites. Also, it contaminates dust and fomites. So this is the infective material. Now we'll see the period of communicability. Till how much time this agent can transmit a disease from the onset of disease, right? That is 14 to 28 days from the onset of disease. Till this much time, this disease can be transmitted. Now this is regarding whole regarding the agent factor. Now we'll see the host factor. Host factor might basically infects the children of 1 to 5 years of age. Okay, and both sexes, either male and female, both are equally gets infected. Then this disease are likely to occur in the children or the person who cannot able to produce antitoxin regarding this bacteria, which releases the exotoxins, right? We need the antitoxins regarding this bacteria, right? So it affects only to those children which cannot produce this antitoxins. Fine. And the infants who are born to the mother who is previously immunized, are likely to get immunized for certain period of their life, certain months of their lifetime. Okay. Then we'll see the environmental factors. So all the respiratory diseases are likely to occur during the winter season. So today we'll see till here only, and further we'll see into the next class.